What will we do with this moment? How will we be remembered? This is our future and our choice to make. I am asking you to choose greatness.
Thanks to President's strong leadership and the professionalism of all of our federal agencies, Health and Human Services, CDC, and state and local health officials all across this country, the risk to the American public of contracting the coronavirus remains low. To be clear, if you are a healthy American, the risk of contracting the coronavirus remains low. But it is still a good idea to engage in common sense practices that are always recommended this time of year. So, as someone who has a mother who's 87 years of age and who has married kids living around the country, a brief tutorial on prevention for yourself, for your family, and your loved ones. It's a good idea to stay home when you're sick. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Cover your cough or sneeze with tissue. Throw the tissue in the trash. Clean and disinfect frequently. Wash your hands with either a disinfectant or with soap and water for at least 20 seconds. And let me say again, as we've said before, there's no need for Americans to buy masks. The common sense practices that I just described are all available at cdc.gov. Today we had a series of meetings here at the White House and on Capitol Hill. We met with executives of the airline industry, the executives of commercial labs, executives of nursing homes. And our team also met with the Republican and Democrat caucuses in the House of Representatives. And we were pleased to learn that just shortly ago, the House of Representatives passed a federal funding bill by a virtually unanimous margin. It will now move to the Senate. And the legislation implements the President's vision to ensure that not only do our federal agencies have the support and resources that they need, but also that our state and local partners have their support. And in my conversations with governors all the way through this afternoon, I know they're grateful for the bipartisan spirit that has characterized this funding bill, and we'll continue to work through that process. As President Trump said, we're all in this together. And he deployed a whole of government approach, but thanks to the President's leadership, it has actually developed into a whole of America approach. The President also met today with airline executives, and I'll reiterate, as the President said, our profound gratitude to our partners in the airline industry. They have worked with us in, as we say, flowing Americans through particular airports, the screening. We're working very closely with the airlines on contact information. If a person is tested as positive for the coronavirus, we're working with the airlines to get all the information, not just about that person, but about who they sat next to and who else was on the flight. And the President and I are very grateful. As we announced yesterday, I'm pleased to report that as of yesterday morning, in addition to the travel ban from China, we've suspended all travel coming in from China. We've suspended all travel coming in from Iran, and even foreign nationals who visit either one of those countries are barred from coming into this country for 14 days. We also established a travel advisory for Italy, portions of Italy and portions of South Korea over the weekend. But even as importantly, as of yesterday morning, we fully implemented a screening process. All direct flights from all airports in South Korea and Italy are now being subject to multiple screens before passengers board to come to the United States of America. The State Department worked very vigorously to bring that about, and we're grateful for the cooperation of the governments of Italy, the governments of South Korea, as well as our airline partners in making that a reality. Finally, with regard to testing, we had a meeting today that gave us great hope for great progress in the near future on expanding testing across the country. We have a ways to go yet, but I'm pleased to report, as we've been able to convey to state governments, governors around the country, is that thanks to the good work of the FDA and Dr. Steve Hahn, who's with me here today, now all state laboratories, all university laboratories at the state level can conduct coronavirus tests without any additional assets or resources from the federal government. They have the FDA-approved test. They can conduct the test all across the country in all the states. Beyond that, as we announced through the efforts of HHS, 2,500 kits of tests are going out this week. 2,500 kits, including tests, is going out this week. That's roughly 1.5 million. A test that will be available this week. We'll continue to build on that number. But perhaps most significantly, thanks to Dr. Birx's efforts and leadership, we brought together today at the White House the leaders of all of the largest commercial laboratories in this country, companies like Quest that have vast capabilities, logistics and testing capabilities. And we were pleased to report today that they have created a consortium to share information and to share resources, and literally have told us that as they go through what is called the validation process on testing, that by next week, individual companies will be able to do, as they said to me, thousands of tests of coronavirus if they are needed and required, and many, many multiples more of that in the not distant future. Our objective here, as Dr. Birx raised with the task force, is we've got hospitals in affected areas and those that are requesting that have kits. We've got universities and state labs that now can perform the test on a requested basis. But our objective ultimately, and as quickly as possible, is to have tests made through these commercial laboratories and commercial providers that your local doctor, your CVS, your MedCheck is able to have a coronavirus test. And that isn't there yet. We're working to make that a reality. But again, it's one more example. It's not just a whole of government approach, it's a whole of America approach. Whether it be our nursing home industry, whether it be our airline industry, whether it be our commercial laboratories. I can speak on behalf of President Trump and our entire task force when I say we are profoundly grateful for the spirit that's being reflected by companies all across the United States of America. Grateful for the leadership at the state level, and the American people should be confident that that spirit of partnership is going to continue to drive this at every level as we work our way through dealing with the coronavirus in the United States. With regard to the cost, let me be very clear. HHS has designated the coronavirus test as an essential health benefit. That means, by definition, it's covered in the private health insurance of every American, as well as covered by Medicare and Medicaid.
Thank you very much. Possibly a question for Dr. Birx regarding it being safe to fly.
Please.
You have spring break coming along. A lot of grandparents may be coming to visit family members to help watch over kids. Older adults, is it safe? If it's unnecessary travel, should they still hop on a plane and travel?
Well, that's why we're talking about the common sense approach. So if you have pre-existing medical conditions or you're of the elderly and frail, that is something that they need to take into context. And that's why we were very clear about providing that information, because we really want everyone to know what we know, that we've received this new data, we've gone through it carefully. It does look like there is significant greater risk of serious illness as you become older and if you have other medical conditions. Now, what I talked about also was protecting the elderly and protecting those with other medical conditions. And I want to be clear, the other medical conditions included people recovering from cancer. So just as you would protect them when they have their chemotherapy and their immunoresponses are lower, you would do that with careful hand washing again, and ensuring if you have children in the household that they're following those same procedures. I have a 9-month-old and a 2-year-old grandchild, and the 2-year-old has learned to wash her hands. carefully. And I think these are just things we need to ensure are happening every day in households.
Mr. Vice President.